what happened. Sorry, you might assume every lab offers the same care and technology. That's not the case. Sorry, we were just chatting. This is crazy. Choosing the right one can make all the difference, and I wish I had you in my life then. Joining us now to share her expertise is Dr. Marjorie Dixon. It's so good to see you.
It's good to see you.
You've been advocating for us ladies forever.
Forever.
And I get emotional because I just told you, I tried going to a clinic in 2013, 2012. Didn't work out for me, and I wish I had you, and I wish I had this information. So please listen up if anybody's going through, because so many men, women, couples are affected right now. Let's start with this. I'm going to get a hold of myself. Why does the quality of the fertility lab make such a big difference? So they're not all created equal.
No, they might look the same on the outside, but the fertility lab, the embryology lab, is the heart of an IVF clinic. And really, so everything is controlled. Temperature, pH, the media, the juice that we grow embryos in, the osmolarity, all of that, even the temperature of the places where the fertilization happens, the micromanipulation where we actually do the sperm into the egg, all of that has to be state-of-the-art technology, maintained, and continually improved so we can get the best embryos possible so that we can get to live births for our patients.
Right. And and we think about, should we freeze our eggs? Should we not freeze our eggs? There's so many questions. You're gonna tell us and talk through each one as to why these questions are important. So write these down. So as a patient, you have to ask things like, who handles my eggs and embryos? And are they certified?
Yes. So they're expert embryologists and andrologists. The embryologists are different levels. So you can have a junior embryologist, you can have a senior embryologist who has way more experience, who can do everything that needs to be done around the fertilization. You have the lab directors, and the lab directors are sort of the ultimate managers and orchestrators of every activity in the flow through the lab and manage the staff, the processes, the procedures, and the technology.
Okay. Up next, you say to ask this, how are my samples tracked? So what safeguards prevent mix-ups?
Right, and this is a big one for people because shows like Law and Order come up with the most salacious scenarios. So labs have what we call verification systems. So that means that every step of the way, when there's an exchange of eggs that changes hands or sperm, there are 2 steps of verification, and we call that witnessing. So we at Anova have a combination of electronic witnessing, so our patients get an armband with an identifier, a unique identifier, that's matched to an identifier in the embryo hotels where the embryos live and grow, okay, which are the incubators.
That's cute, the embryo
Yeah, I call them embryo hotels.
That's cute.
Some are the Hiltons, some are the Four Seasons. But yeah, so it's important for patients to understand what kind of verification steps do you have? Do you have an electronic witnessing system? Even the best electronic witnessing system requires humans to manage it.
That's right.
So the SOPs, we have very stringent, I'm OCD for a reason. Yeah. We have stringent standard operating procedures, and those have to direct every single step that happens in the lab so that there are no mix-ups. Even the rate at which people move in a lab, we make the embryologist walk slowly so that there's no opportunity for collision or mix-up in the lab.
The most precious of cargo.
Yeah.
Next question, what are the clinic success rates and how many embryos reach the blastocyst stage?
Right, so this is a big one. So you think about a health of a business, has key productivity indicators, KPIs, so does a laboratory that's making human life, okay? So you want to be able to know when you take an egg and you expose it to sperm, in your clinic's hands, what's your fertilization rate? A top-tier fertilization?
I know they're being honest.
Well, that's the thing. But there are those steps. So there's the fertilization. How many of those embryos that are fertilized then move into the blastocyst stage? The blastocyst stage is 5 days of development. That's the final stage of development before an embryo can be tested and put back into a uterus. A top-tier lab should have at least a 50 to 60% blastocyst rate. And the issue is with newer labs, they don't have track record or experience or the ability to speak to those. And you have to be careful because, yes, some labs will report like it's baseball season. So you think about an all-star team. If you're only reporting the stats of the people that hit home runs, of your best players, you're going to have the best stats. So some labs actually will exclude certain patients. So you have to be careful to ask that question. Is this for all comers? And we sort of also layer it by age. The younger you are, the better that statistic should be in the laboratory. So speak to your physician and speak to other patients who have had experience. At Anova, we've been making babies for 10 years through the funding program. And especially in Ontario, or as I've advocated for funding so people can get to care, it's important if you have one kick at the can to know where you're actually going. And to your point where you mentioned to me earlier, you wish we had met or you knew us.
Yes.
You know, Anova came out of a need to be that place. And patients can advocate for themselves and ask to go to specific places where they know the laboratories are top tier, have the track record and the experience, and the transparency to include patients in the conversation. We have conversations with our patients all the time about what it is that we do in the lab. That transparency is key, and the ability to be that way is what makes us so proud to be our patients' friends in fertility. That's
and
what we
you've
say.
been a patient, so you understand what it feels like to be on that other side of it, and it comes through in everything that you do for everybody else in the same situation, even though everyone's situation is completely unique and has to be tailored to them.
Absolutely.
Okay, so you say talk about transparency, accountability. Is there anything else you want to say to anybody out there before we wrap up?
Yeah, I say do your homework. And when you get referred, you don't just have to go wherever the physician refers you. You can advocate, you have agency, you have autonomy to determine where you're going, because again, with funding programs and increased access, it's not just go wherever, it's go where you should go to have the best outcomes, that have the experience, the ability, the wherewithal, and that prioritize patient-centered care for best outcomes.
Yes, and you just relieved me, because a little inside knowledge. I said, I wish I had thought to freeze my eggs. I was only 36 and I didn't think I would encounter all of these problems.
Yeah.
And you said in 2012, the technology wasn't refined enough to be able to do it properly. And that provided me, oddly enough, with some relief.
Well, I'm glad. And yes, vitrification, there are continual advancements. And you have to go to a physician who can speak to it and allay those fears and explain the history and explain vitrification makes us freeze eggs and thaw them and make babies well. But free yourself. It's only, 13 years old.
Yeah. Dr. Dixon, where do we get more?
Instagram, so drmarjoriedixonofficial.com and then AnovaFertility.com.
You're amazing. Thank you so much. And she even somehow weaved baseball into there. We just love her. She's always hitting home runs, right? And all the babies in the world. You're their aunt forever.